My name is Dr. James O'Donovan, and in this video we're going to cover key things you need to know about dengue, also known as dengue fever, an infection that is spread by mosquitoes. In this video we're going to cover what dengue is and the countries it is typically found in, symptoms of dengue, treatments, and finally prevention. So first of all, how do you get dengue? Well, you can get dengue if you're bitten by an infected mosquito, which typically bite during the day. Dengue is very common in certain parts of the world, especially in tropical areas, such as parts of Africa and Asia, Central and South America, the Caribbean, the Pacific Islands, and some southern areas of North America, which you can see on this map here. There's also a risk of getting dengue at certain times of the year from around spring to November in parts of southern Europe. European countries where dengue has been found includes Croatia, France, Italy, Spain, Portugal and Madeira. However, dengue is not found in the UK currently and you cannot catch it from another person. Now you can check the risks for a country that you're travelling to on the Travel Health Pro website, and I've included a link to this helpful resource in the description box of this video. So now we know a bit more about what dengue is, well, what are the potential symptoms and signs of dengue? Well, for this section we're going to cover some of the more common symptoms and then also some of the more severe symptoms, which, whilst less common, are still important to be aware of. So the first important point to note is that dengue does not always cause symptoms, but if you do have symptoms, they usually start 4 to 10 days after being bitten by an infected mosquito. Some dengue symptoms are similar to flu, and they can include a high temperature, a severe headache, pain behind your eyes, muscle and joint pain, feeling or even being sick, swollen glands, or a blotchy rash made up of flat or slightly raised spots, which can affect large areas of the body, and it can look like this. Importantly, if you feel unwell after travelling to a country where dengue is found, or if you've got any of these symptoms, you should speak to a healthcare professional. Similarly, you should always seek medical advice if you have dengue symptoms while you're travelling. Now, these are some of the more common symptoms of dengue, but what are the symptoms of severe dengue? Well, these can include severe tummy pain, repeatedly being sick, fast breathing, bleeding gums or nose, extreme tiredness, or being unable to relax, known as restlessness, or even blood in your vomit or poo. Severe dengue can be very serious if it's not treated quickly in hospital, so it's really important to go to hospital as soon as possible if you get severe dengue symptoms whilst you're travelling. So now that we've covered symptoms, let's briefly discuss treatments for dengue. Well, the first thing to mention is that most people with dengue feel better in a few days, and whilst there is no treatment for dengue, you can help ease your symptoms by resting, drinking plenty of fluids, and taking paracetamol to help bring down your temperature as well as ease any pain. Now, in addition to doing these few important things, there are a couple of things you should avoid doing. So firstly, it's important to not take anti-inflammatory painkillers, things like ibuprofen or aspirin, because these can actually cause bleeding problems if you have dengue. If you've got severe dengue, you'll also need to stay in hospital until you recover. Finally, how can you prevent dengue? Well, if you're at increased risk of getting seriously ill from dengue, you should actually consider not travelling to the countries where the infection is found. At-risk groups include those people who are very young, those people who are older, so over the age of 65, are pregnant, have got a weakened immune system, so from things like maybe HIV, have certain health conditions including asthma, diabetes, high blood pressure, or a condition that makes you bleed more easily, or if you have had dengue in the past. Now, if you're in a country where dengue is found, the best way to prevent infection is to avoid being bitten by mosquitoes. And now we'll cover a couple of top tips to try and help you with this. Firstly, I would say wear long sleeve clothing and trousers to cover your arms and legs, particularly during early morning and early evening. Secondly, use insect repellent on your skin. Thirdly, close windows and doors wherever possible, or use blinds or screens. And also try to sleep under a mosquito net that is treated with insecticide. Finally, you can always get advice from a travel clinic if you're traveling to a part of the world where dengue is common. Finally, it's worth mentioning that there is a vaccine that helps to protect against dengue. It's recommended for people who have had or might have had dengue in the past and are travelling to a part of the world where dengue is common. Now, to learn more about dengue, please find lots of other useful resources in the description box of this video, and if you've got any comments or questions, please also leave them in the comments section below. Thanks for watching, and bye.